I think you've described a much similar COVID response comparing to us. I mean, there are some similarities in terms of the epidemic curves in Brazil, in the US, and as well as you may know, New England Journal of Medicine published an editorial yesterday or the day before yesterday entitled "Dying in a Leadership Vacuum."
Yeah.
And it's interesting that because if you look, if you read some parts of the editorial in terms of saying that the U.S. federal government largely abandoned disease control to the states, or governors have varied in their response, you could translate this or adapt this exactly for the Brazilian experience. The difference, the only difference I would say is that we are not a superpower, and so you know. I'm sad to tell you that, but in somehow we still see the two epidemics on a quite similar way as you has just demonstrated. But my question to you would be if you could comment in terms of the next challenging, which means returning with schools, university teaching and strategies and so on. We've been in a hard pressure in terms of Brazil is probably one of the country that's interrupted for the longest time. I mean, more than 6 months without kids and adolescents having classes. And that may have a huge impact in terms of mental disease, in terms of the consequences. And if you please could comment on that, I thank you so much.
Sure, thank you. We're having the same thing. We are in many places the schools are still shut, and people are doing virtual teaching. Some of them are doing hybrids where it's half the school is in, half the school is shut, in order to have more distance between the kids. You know, what we've discovered scientifically, as you well know, is it does appear that the younger kids are a little bit less likely to get the disease and transmit it, but once you're above age 10, there doesn't seem to be much difference between the kids and adults. We've seen some huge outbreaks in universities that tried to open, and some of them have closed back down. University of Notre Dame did that. University of North Carolina did that. Others have done okay with widespread testing of the kids. So it's a mixed bag. You know, the best predictors of whether the schools can open and stay open really are the level of the community, you know, spread and the amount of, the test positivity in the community at the time. And so, you know, that's part of the messaging to people that if you want your kids back in school, it's the behavior of the adults that are going to determine whether the virus is low enough to reopen the schools. The usual numbers that people are using to trigger an attempt to open the schools is less than 3 to 5% test positivity in a community. And obviously that's highly dependent on the amount of testing. But yeah, I mean, there's a great appreciation as there is there that it's one thing to keep the bars closed, it's another to keep the schools closed. You're talking about weighing health consequences on both sides. And so I think we're probably in a pretty similar situation as you are in. The experience doing virtual teaching has been mixed. It's probably better than nothing, but certainly not as good as in-person teaching.
Thank you so much.
I mean, what are the rules there in terms of who is opening and how they're opening and what they're doing in terms of trying to keep everybody safe?
We have some states in the northeast and especially in the southeast region of Brazil. I mean, Rio and São Paulo, who's trying to restart with classes. I mean, kids and adolescents, not university yet, but we still think in terms of the huge impact that it may. The prevalence, to give you a picture, the prevalence of COVID-19 infection in São Paulo, the biggest state in the country, is 20%, which says a lot in terms of the second wave or the consequence of opening on a massive way
Yeah.
schools.